Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. J. Calvert, and I am here today with not only my most amazing and excellent co-host, Dr. Millicent Rovelo. How are you?
I'm doing great. How are you?
I'm doing great. But you are also the subject of this podcast.
I know, I'm the patient.
Wow. It's very different.
It is very different. So, special podcast, we are going to be talking about a surgery that I recently had. You were my surgeon, I was the patient, and we just want to talk about the experience.
And not an easy patient, by the way. No, just...
I think we established I was the worst patient.
So doctors as patients could be a whole, like it could be a podcast of its own.
For sure.
I mean, doctors as patients, typically they know better. They want to do it their way, and they typically have problems because of their intense knowledge of the subject matter of what they're going through.
Well, I don't think I did that.
No,
I
you were
just
great.
think that well, we can talk about my recovery. I just didn't know when to stop doing things, even though I know better. But we'll get to that. So let's just walk through, sort of what we did here.
So the operation that we did and so first of all, what caused you to say like, hey, I got to talk to my pal Jay about doing something?
So my concern as I was aging and getting older was that I noticed that my under eyes and the junction between the lower lid and the cheek was becoming very pronounced. There was a groove there, and I constantly had to put under eye concealer on to conceal it. So that was my initial concern, was that lower lid junction there. And then my other concern was my eyebrows. They were starting to descend and sit lower, and it was giving my eyes more of a closed, pinched off look. And if I did too much Botox, I would really notice it because my eyebrows would drop even more. So those were my two main concerns, were sort of that whole upper eye, upper face area.
So you think Botox was hitting its limits?
It was, but the problem was the Botox was wearing off faster and faster because I actually needed to use my forehead muscles to lift my eyebrows. It was a functional thing. And then when I would freeze those muscles with the Botox, then they couldn't do their actual job, which was to lift my eyebrows, and they would sink even lower.
So there you have it. It was all about lower lids and the brow positioning.
Right.
And so the optimal operation for that is really a brow lift and a mid-face lift combined with the lower lid blepharoplasty.
Correct.
And what that is, and that's very fancy terms for lifting of the cheek, which is a mid-face lift. We call this mid-face because the typical facelift is when we make cuts around the ears and we lift the skin and the thick tissue over the muscles. This is really about a cheek lift, a lateral brow or a temporal lift where we're lifting the tail of the brow and the temporal skin. And then by going through the lower eyelid and releasing the junction of the lid, you can blend the lid cheek junction and not need as much concealer.
I haven't used any concealer since the procedure, which is so exciting because I'm also a bad driver. I will do my makeup when I'm driving on occasion. And so I'm looking.
Confessions of a Beverly Hills plastic surgeon
on my way to work. And so
you're not the only one, by the way.
Bright daylight, I'm looking in my car, at myself in natural light, in my rearview mirror or in my little vanity mirror in the car. And that's when I would really notice the pronounced, not even circles, but just volume loss between the lower lid and the cheek. And there's a ligament there. It has a name, the orbitoretaining ligament. And so that ligament is what really was pronounced. And I needed to have it released so that you could then lift my cheek up. See, I'm telling you your job.
All right, you know my job. I thought the interesting thing was when you were thinking about doing this, you came into the OR and watched me do one.
I did,
which
yes.
would have, for me, been like, okay, I'm definitely not doing that. And you were like, okay, I'm ready.
Okay, I'm next. Sign me up. My turn.
Yeah, I mean, it does work. I mean, it's a very effective operation. And, the thing that people see with it is... Why don't we wait for the sirens to complete?
To pass.